With the use of artificial intelligence, Dr. Emily Jefferson and her team at the Health Informatics Centre, based at Ninewells Hospital in Dundee, have produced a piece of technology which can help physicians going forward to detect illnesses which may not have been seen with the naked eye.
So routinely collected electronic health records are incredibly valuable for research purposes to really understand population level disease and progression of disease. And we've been working in this space for many years now, and we're moving into working in clinical imaging. So every day across the country, many different images are collected, both CT, MRI, nuclear medicine and X-rays, and these are all stored on a national PACS system, a national database, and they're used for clinical care, which is fantastic. But they are underutilised for the purposes of research. There is an emerging field of artificial intelligence, which can be really, really helpful for assessing people's clinical images and helping a radiographer in their diagnosis of particular diseases. Most of the time, though, artificial intelligence algorithms are trained on maybe a few hundred or a few thousand images, but actually if they're trained on far more images from a real-world setting, they can be significantly improved. So the whole purpose of this project is to provide artificial intelligence algorithms with many hundreds of thousands of images in order to improve their accuracy. And this has to be done in a very controlled way, because this is patient-level information. So only anonymised information is provided, and also the data remains under the control of the NHS at all times. We've been using routinely collected text-based medical records for many years, providing them securely within a safe haven environment for researchers to access and query this sort of data. So this is now an extension to using this text-based information, and it's incorporating clinical images as well as the text-based information to do real population-wide studies.
This groundbreaking discovery has once again put Dundee on the map. As well as this being available to physicians the length and breadth of the country, Jefferson also expects the technology to get interest from around the globe.
Scotland has a fantastic underutilised resource in this national PACS system. So we have data for the whole of the Scottish population going back to 2006, and because it's collected from 14 different health boards, from many different types of machines in many different environmental conditions, it's highly heterogeneous, which means that when you're going to train algorithms, they're very generalisable for real-world conditions, whereas other centres where you can get data, it's usually only on a particular machine type in particular environmental conditions, and that doesn't help you train for the real world setting. So we think that this data set will be absolutely invaluable, not only for locally, but across Scotland and across the UK, in order to make this resource available for many different groups, both academic and industry partners, to be able to come and train their algorithms here. We're very much expecting other international partners to come and view the data and utilise the data as well. It is actually quite inefficient for radiographers to look through all of the images as a single individual every single time, and particular diseases get missed. They're missed by the human eye. Machines are actually really good at understanding hundreds of thousands of images and finding things that humans miss. And so this isn't about replacing humans. This is about providing them with additional information which can help them diagnose things which they might otherwise have not spotted. Treatments are far more likely to be successful. So for instance, in the case of lung cancer, if you catch that very early on, you have a really good outcome, whereas if you miss something and the lung nodule is missed when you're assessing an image, you're far more likely to be treated later and have a worse outcome. The fantastic thing about this project is it's all around trying to get these algorithms used directly in clinical care as soon as possible. So rather than doing abstract research where you go off and you expect something to come back into clinical care 30 years down the line, this is about using active real-world data right now, working with academics and industry to produce artificial intelligence algorithms which can be used directly by clinicians within sort of a 5-year time span.
The City of Discovery has delivered once more. This transformative breakthrough could help save lives in the future throughout the world. Jordan Burke, That's TV.